Hey everybody, Nick Licameli here with Technique Peek. You got some nerve. That's right, today we're talking about the sciatic nerve and why sometimes treatment for a flared up sciatic nerve has not so much to do with adding something in or finding the right treatment or manual technique, but rather removing or stopping what's irritating the sciatic nerve. So it's almost like taking your foot off the gas rather than pressing the gas and the brake at the same time. Today I'm going to show you some ways that we may be flaring up the sciatic nerve and not even realizing it. Let's take a look. So just a quick review of the sciatic nerve here from the archives. I have the band on the skeleton representing the sciatic nerve. You can see that it starts up in the spine and travels down behind the leg, under the foot, and into the toes. Now we're going to use the slump test as a reference throughout this video, and ways to kind of get out of that slump test position with the head, the neck, the trunk all kind of flexed forward in a posterior pelvic tilt with hip flexion, knee extension, and ankle dorsiflexion. So ways to reduce tension on that nerve, as we all know, we could flex the knee, we could sit up straighter, we could do a chin tuck, kind of retract our cervical spine, and we could also plantar flex the foot. So we're going to use those throughout this video. So we're going to start on the treadmill and we're going to do some incline walking. So as the incline goes up, that's going to increase the amount of dorsiflexion at my foot and ankle. Majority of the time a patient is on the treadmill, this is what we see, right? We see them kind of hunched over like this, and in this position, bang, slump test. So is incline treadmill walking bad? No, but if it's done like this, it could be bad. So how can we modify it to make it better? We're going to cue the patient to stand up nice and tall, shoulders down and back. We're going to teach them to engage the glutes as they walk, and we're going to cue a cervical retraction with a little bit of a chin tuck, and we're going to stand upward like this. That's going to help reduce some of that tension on the sciatic nerve. If that doesn't work, we could just lower the treadmill down, and that will reduce that amount of dorsiflexion at the foot. Another simple adjustment would be to cue a smaller stride length, because a smaller step will reduce that stretch on the sciatic nerve. So next on to the leg press. With the camera angle here, I kind of lost my head on this exercise. Come on, this kid will be here all week. He's on fire with these puns. What we usually see on the leg press is this, right? Patients are on their phones. This is basically a slump test. They're kind of hunched forward. And same thing with a calf press using the leg press, if not more so, because you're getting that stretch into dorsiflexion in this slump test position. So how do we make it better? Cue the patient to sit up straight, chin tucked, cervical retraction, shoulders down and back, and keep more of a neutral lumbar spine. This will help reduce that tension on the sciatic nerve. On to the slant board. So slant board is a great way to stretch the calves. It can also be a great way to flare up a sciatic nerve. So as the patient is on the slant board, if they kind of hunch forward like this, we're coming close to that slump test position. A way to make this better, just cue the patient, once again, stand up straight, cervical retraction, chin tucked, shoulders down and back, more of a neutral lower back, and that will help reduce that tension on the sciatic nerve. Onto the straight leg raise. So if the patient kind of curls up like this, which is kind of common, if they're watching TV or watching other patients or talking to other patients or looking at their phones, they are basically getting into, once again, that slump test position. How do we make this better? We cue them to keep their heads down, or that little plantar flexion there that I just did will also help reduce that tension on the sciatic nerve. So the next one is basically just a positional change. So a lot of times the patients will sit on the tables like this, waiting for us or getting some heat. And this is basically a slump test position. They're hunched forward, looking at their phones, reading a magazine, watching TV. And so we could be trying our best, everything that we know, to, kind of fix that sciatic nerve, quote unquote. But if they are sitting like this during our treatment, we're just flaring up that nerve and kind of undoing any good that we may or may not have done. How do we make it better? Cue the patient to keep their heads back on the table, bend the knees, or even add a bolster under their knees like I'm showing here. This gets us out of that slump test position. Next, we have my all-time favorite exercise, the short arc quad. Sarcasm intended. Hey, I don't judge. There's a place for every exercise. This one is just not one of my go-tos, but it's important to remember if you're going to use this, it could flare up the sciatic nerve if it's done like this. So again, if the patient is hunched forward with that forward head, reading a book, looking at their phones, and they kick that leg up with dorsiflexion, that is basically a slump test. So how do we make this better? Once again, we're going to cue the patient to sit back nice and straight, and we can even plantar flex the foot as I'm going to show here. Up next is something that I think is very important and often overlooked, and that is driving posture. Most of our patients drive, and some of them drive for quite long distances on a daily basis, so it's important to take a look at their driving posture because that can really cause some irritation to that sciatic nerve. I would say majority of people probably drive something like this, and as you can see, it's basically that slump test again. And as they pump the pedal with that foot, they're even adding in some dorsiflexion. So how do we fix this? Bring the head up, scoot back in the chair to kind of get out of that slump position, push the seat forward, which will cause more knee flexion as you reach for the pedal, and you could even put like a small towel roll or pillow behind your back to further get out of that lumbar flexion, that posterior pelvic tilt. And again, so now you can see that my knee has much more flexion and I'm not reaching for that pedal. So as I dorsiflex, it's not quite that slump test position. So it's important to ask what kind of car the patient drives because different cars are going to be set up differently. So if you're anything like me, this is more difficult for me in my Lamborghini because it's hard to kind of push that seat up and sit up straight. But I'd rather have sciatic pain than not drive my Lamborghini. Up next, we have the hamstring stretch. Yes, the standing hamstring stretch. So clearly, this is the incorrect way to do it. Now, whether or not you're going to do this exercise or not is up to you. No judgment here. Just, again, not one of my go-tos. But if you're going to do it, make sure you do it right. So you don't want to slouch down like that because, again, that's that slump test position. What you want to do is keep a neutral spine, almost a little bit of a lordosis, and kind of lean forward and hip hinge and lean forward from the hips. If that still causes that pain, you can always point the foot and plantar flex that foot. But again, not one of my go-tos, but if you're going to do it, make sure you do it effectively and in a way that's not going to flare up that sciatic nerve. Sticking with the hamstring theme, again, no judgment if you're going to do this exercise, just not one of my go-tos. If you're going to do the hamstring stretch with a strap on the table, be sure the patient isn't bringing their head up like this to watch TV or look at the other people in the clinic, because again, that is getting closer and closer to that slump test position. You can also plantar flex that foot, which is going to also reduce tension on that sciatic nerve and get us out of that slump test position. So the takeaway here is that sometimes the reason for our patient's symptoms are not from a hypomobile facet joint or some sort of asymmetry that we assessed and diagnosed with our flawless palpation skills. And the treatment may not be bird dogs and manual treatment and piriformis stretching and nerve glides. It may just be finding what they're doing that keeps provoking their pain. And once we find that, simply provide education to our patient and empower them and let them know that they have the power to help themselves. And as a team, help improve their quality of life without creating dependency. I hope this helps. Thank you so much for watching this episode of Technique Peek, and we'll see you next time.